If you don't mind, I'm going to just call out attendance, just saying who's with us tonight. With us tonight, we have Councilperson Langella, Councilperson Keegan, Councilperson Shanahan, Councilperson Revolus, and Councilperson Johnson, and myself, George Tsironides, acting chair for tonight's meeting. Moving on to item number two, we're going to approval of the May 27, 2021 meeting minutes. Would anybody like to move that? Thank you, Ms. Shanahan. Are there any corrections, additions, changes? Seeing none, all in favor? It's unanimous. Number three, public participation. Now, Megan, I know this just got dropped on you tonight.
Yeah, nobody's in the.
Is there anybody in the waiting room or, okay.
No, nobody's there.
Any council person had anything emailed or sent to them that they would like to read into the minutes? Neither have I. Okay, moving on to new business. Item number one, authorize the mayor, Harry W. Rilling, to enter into platform activation agreement with Guardian Alliance Technologies, Inc. account. Would anybody like to move the item? Thank you, Councilperson Revolus. And with us tonight, we have Deputy Chief Walsh. I'm assuming you'll be speaking on that?
Yes, I will. Thank you. The police department is in the process of revamping and revising our background procedures for hires and lateral applicants. Part of these revisions, we found a company that uses a cloud-based software platform, Guardian Alliance Technologies, to track background investigations. It also provides for a social media search engine to provide all their social media content, and it allows the whole background application to be put in a cloud base, so we could send it out to the police commission, and they could view the progress as we go along. So it allows more transparency through all the parties involved in a background. Right now, we have a paper method, and the whole background application process will be available in a cloud base available for viewing and transparency.
That's fantastic. Chief, have you had any experience with this company or worked through any other departments?
No, we have not. This is a new company that we found about 2 weeks ago. To go from what we're using now in binders and paper to put it all on, we're stepping up the technology in our background investigations. So if the police commissioner or the mayor wants to see something, we can send it to them electronically. It doesn't have to be in paper form.
Welcome to 2021, millennium. All right. Any questions, anyone? Any of the other council people? Yes, Ms. Johnson.
Thanks, Mr. Tsironides. So, Deputy Chief Walsh, I think that this obviously really is something that the Police Commission talked about this past Monday, obviously for it to be here. And they talked about it also in terms of the other things going on in the department about hiring practices. Are there a couple things that you can just let us know that fit into this agenda that you all have taken on for those people who may not have been able to go to the Police Commission meeting? Like how this also fits into the new hiring practices or vetting practices you're going to be undertaking?
Yes, we did have a, let me pull up those notes because I had this all set. What we are doing is we are revamping our whole application background. And we did have a meeting with the chief and all the parties involved, and we came up with a whole list of bullet points of added questions. First, we're going to be including a whole chief's level interview, which would include a lot more questions, including maiden names, some of the points that were brought about last month, current legal lawsuits, current civil suits, anything in their background that would bring disparaging reputation and things like that. And also we're going to add a whole level of new interviews with the police commission and the mayor, which we've never done before. And they'll be allowed to ask their own questions. And we're adding a whole nother step in the process before we offer anybody a position.
That's great. Thank you. That does sound like we're doing a more relooking to make it a 21st century HR practice. So that's really excellent to hear.
Yes, we're revamping everything from.
It definitely sounds like a real-time information portal as well. So
Yes.
that's fantastic. Any other questions? All right, seeing none, all in favor? Passes unanimously. If you don't mind, I'm going to put item 2A and 2B. I'm just going to read them together and pass them as one. Item 2A, authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept grant funds from the Department of Justice under the fiscal year 2021 Edward Byron Memorial Justice Assistance Program in the amount of $35,428. 2B, authorize the police chief, Thomas Kohalik, to execute any and all agreements, documents, instruments, and amendments thereto as may be necessary to implement all programs through the fiscal year 2021 Edward Byron Memorial Justice Assistance Grant Program pursuant to such grant funding. Would anybody like to move the item? Thank you, Ms. Revolus. Chief, will you be speaking on that as well?
Yes, these are grants that we've received before. They're called JAG grants, or the Edward Byrne Memorial Justice Grant. We use those for extra patrols to bolster our regular staffing on the platoons. We usually, we've had some high-profile incidents the past 6 weeks, a couple of shootings. We'll be addressing those hot spots with selective enforcement, Suncrest Road, some of our other areas that we've identified, putting out two-man cars. And some of it is also used through our motor vehicle enforcement unit to address some of the traffic concerns. We do get a considerable amount of speeding complaints still, but it's usually it's all ad hoc by the week, where we need the money. It's get distributed through our overtime distribution. Officers sign up, and then they get assigned, and then they have to hand in a activity sheet at the end of the night about their activities. So it is tracked what they do, but we assign the location based on what is needed for that week.
That's great. And personally, I'm familiar with it because obviously I've seen it in prior years, and it has helped out, like you said, especially with speeding in hot spots. In our district, personally, Mr. Keegan, I know we've had problems on East Rocks Road. Through this fund, we managed to put extra cops out there on patrol. We managed to stop, or at least curb a lot of that speeding there. Is there any questions, any comments, anybody from council? All right, seeing none, all in favor? And it passes unanimously. Thanks again. All right, I'm going to suspend the minutes now to add an item that came forth that needs to get approved sooner than later. Item number 3, authorize the mayor, Harry W. Rilling, to execute service agreement 3 years with automatic 1-year renewals with Police App for services related to police candidate testing, recruitment, and tracking. Would anybody like to move the item? Thank you, Ms. Johnson. Chief, I guess you're up again.
That's okay.
It's your meeting tonight.
This is all part of the overall revision of our hiring processes. Currently, for new applicants, traditionally, we always have a test every 2 to 3 years where we put out flyers and we do outreach and we recruit, and all the candidates will show up at Brian McMahon and take one big written test, and then we filter out all those results. And it takes months to get a handful of candidates through the whole process. What we're trying to go to is a CPCA exam process. We are a member of CPCA, and what CPCA does, they have a test every month. So if you wanted to be a police officer, you take this test and then you mark off what police departments you want your results sent to. So you take the test monthly, and then people who want to be NOAA police officers will get their results on a monthly basis, instead of doing it every 2 years and then having to field candidates, like 60 candidates at one time. We could better go through and probably slow the process down so we could do 2 or 3 a month and look at them a little bit more closely. And plus, we do get a lot of inquiries from people and say, hey, especially NOAA people, I want to take the test. We just don't have a test, and we tell them, hey, the test is in 1.5 years. And they need a job, and they go become police officers somewhere else. They take another career. So at least with this option, if someone's interested in being a police officer and they're from Norwalk, you sign up through CPCA, you take the test that month, you mark off Norwalk, and we get your results within a couple weeks. So we can start the process right then and there. So we do have some manpower shortages right now. We're trying to make this a little bit more efficient and get a pool of applicants every single month, present them to the police commission a little bit quicker so they could go through the whole process. And for an example, the police commission and our panels used to have to interview 20 candidates in a week. Now we could do 2 to 3 a month as needed and do a little bit of a more efficient process.
That's great. It sounds like not only does this streamline the system, it gives you more time to consider any candidate and do a more thorough background instead of being under the gun or under crunched with 20 candidates at once, like you said.
Yeah, and it gives us better recruitment because we could just shift people right to CPCA, say, hey, the test is in 2 weeks, go take it. And we could have the results within 4. So I think that's really great.
Great. Any questions? Ms. Johnson?
Thank you, Mr. Chernides. It really is more just a statement. I know this is something Councilwoman Revolution said, that I hope that, and it sounds like this will be something that will have folks from our community who live in our community more able to join the Norwalk PD. Is that a fair assessment of this?
That's our goal.
Okay.
And once we get this online, we're going to be pushing out a lot of messaging through social media, especially to Norwalk people that, hey, so we'll be providing links online so they can go right to it until they want to enroll. And we're also looking into waivers, financial waivers, if people can't afford it's like $102. We're working with them right now to see what kind of waiver fee. So if someone has financial issues, we have discussed that, and we are discussing that with the company.
Thanks, Deputy Chief.
That's great. Actually, you answered my question too about how we were going to put that out there to the public. Ms. Revolution.
More statement. I just wanted to thank Councilperson Johnson because he literally read my mind with what I was thinking about what this was going to do. So it was just more of a thank you, and then thank you to Chief as well. But this is a statement, and I appreciate this is coming, and so that we could have a little more local representation on our task force for our officers.
Agreed. Thank you for that too. And Chief, thank you, because this shows we're moving forward with all the concerns and everything that's been said about getting more local people, making it more easy and accessible. I think this is fantastic. Are there any other questions? Seeing none, all in favor? And it's unanimous. All right, thank you very much. Well, that ends all of new business. Now moving on to old business. Discussion items, emergency management update and discussion. Who do we have with us that's gonna address that tonight?
Hi, good evening. It's Michelle. How are you all?
Good, thanks. How are you, Michelle?
Very good, thank you. So I think for the most part, I don't have a whole lot. We did do the hurricane tabletop exercise about 2 weeks ago. I know many of you were able to pop on for that one for a bit. Some good takeaways. So in the next couple weeks, I'll be following up on most of those. Again, nothing too major, but again, especially on the communication side and some of the messaging, I do want to revisit that and just prepare a little bit of a better library of messages. So if something happens, we have some good go-to resources in a couple different languages. Some of the the infographics, so again, very easy to read, easy to process. So just again, trying to build a little bit of a library of those in the weeks ahead. And then obviously just working on some of the heat safety. So as the weather actually gets warmer again, and we start seeing some heat waves, I'll work on doing some of the messaging for that. Then also working with our partners for the safety messages. And I think that's about it.
All right, great.
Thank
Michelle,
you.
I was actually on that call with the hurricane call. You guys did a tremendous job in All the concerns were the same across all the departments, which is wonderful because we at least are on the same page as far as communication being key first and foremost. And then obviously routes and accessibility for emergency services. And again, it sounds like everybody's on the same page. It sounds like everybody's pretty much ready for it. And whatever, you did a great job running that meeting.
Great, thank you. I still worry. Usually 2 o'clock in the morning, there's always something that pops into my brain.
You can't think of
but-
everything if we could.
Exactly. That's just the nature of the job.
Right.
But thank you. And again, I do appreciate everybody that was able to join us for that exercise.
It was a big turnout, so it was good. All right, any questions for Mr. Luca? All right, discussion item number 2, fire update and discussion. Chief McCabe, how you doing
Okay.
tonight?
Good. How are we doing?
Good, thank you.
Good evening, everybody. So I have an update on our fire department activity for the month of May. We responded to 656 calls, averaging 21.2 calls per day. Some of the more notable calls, we had 21 fires, including 2 building fires. We responded to 25 motor vehicle accidents, 374 emergency medical responses, and 27 gas leaks, amongst others. So cumulative statistics for January 1st through May 31st, we're up to 2,745 incidents and a total of 4,326 runs. And we have outpaced our call volume for 2020. So it was a busy month of May. Of those calls, some of the more serious incidents, we did have a construction dumpster fire up against Brian McMahon High School. It was during off hours. There were no students there. That was quickly extinguished by Engine 2 when they arrived. And then they checked the interior of the school to make sure there was no extension or smoke that got inside. We also had a structure fire at 7 Reynolds Street. That fire came in early in the morning. It was already well involved by the time our units arrived on scene. So there was quite a bit of loss there, but luckily there was no one at work at the time and there were no injuries reported at that fire. We also had a watercraft rescue out on Norwalk Harbor. The marine boat, the fire boat, received a call over the marine radio for a boat aground taking on water. It was a 33-foot boat. They were able to get out to the boat and remove 5 people and 2 dogs from the vessel that was in trouble and brought them back into the marina. So a busy month, but everything well handled by the crews. As far as the Fire Investigation Bureau, they had in the month of May 203 inspections, 43 notifications, 51 plan reviews, 8 liquor licenses, and 7 investigations, and they collected $3,720. So our staffing in the Fire Investigation Bureau now, with the COVID rules being relaxed, we're back up to staff again. So they're getting caught up on some of the inspections and the investigations that have been pending. And I'll take any questions.
I was just gonna say, that's fantastic. You definitely had a very busy May, and it sounds like people are starting to get back out and getting back to life and business as normal.
Yes.
Any questions for the chief? Ms. Johnson?
Thank you. This may be a question for both you and Deputy Chief Walsh, but I don't know. Any reports of illegal fireworks yet? Or any of that coming? Because I know 4th of July is coming up.
We have not responded to any fireworks incidents as of yet. Whether or not the police are getting those complaints yet, I would turn that over to Chief Walsh.
We have gotten a handful of complaints. Probably we could have that report ready probably closer to July 1st. That's when they really pick up. Sometimes we get calls of shots fired and they'll end up being fireworks in here. That ends up being the fact a lot of times. But we have not made at this point any fireworks arrests.
I just thought I'd ask because I know that this year probably be just as bad as last year, but hopefully not. But hopefully people are aware that, that there are folks out there that might I don't do, what do you do like for a resident, for example, if they know somebody's in their neighborhood doing this? To just call the anonymous tip line kind of thing, or what?
They
should-
could call, they could dial 911, they could dial 854-3000 and just use the regular
Okay.
line, or they could use our new text app.
Right, okay,
That,
Excellent.
and that has been very busy. People are using that all the time now. It's become a great resource. Sending us pictures, sending us information, and we have a continual dialogue. So it's
That's
working
great.
out very well.
thank you, chiefs, appreciate it. That's great.
Any other questions? Okay, thank you, Chief McCabe.
Thank you.
Health Department update and discussion. Deanna.
Hi, good evening, everyone. So I'm just going to give a quick update and I'm going to pass it on to Brian, who's going to be able to just give his update on where we are with COVID. So as everyone knows, our vaccination efforts continue. So we continue to partner with the other vaccine providers on offering clinics, throughout the city in different locations, and we continue our outreach and education about, prevention measures for COVID-19. Cases are very low right now, and so Brian will go into that. In terms of other activities with the health department, it's the summer coming, so we've been started the beach testing, the water quality. So there are 15 beaches that our staff and interns are testing weekly to determine safety levels for swimming. So that has been going on. We're also just relaunched our Growing Gardens, Growing Health program. So we last offered this 2 years ago. This year we're doing it a little differently. We're doing the gardening programs in Fodor Farm, the gardening lessons, but then the cooking lessons, cooking demonstrations are being offered online. So it's a new way of doing the program, but we're excited to be offering that again. And then we're also getting back to looking at, reaccreditation. So we're going through that process right now. It got put on hold because of COVID. So we're getting back to that. And we're looking at, moving forward, updating our strategic plan, our workforce development plan, our quality improvement plan, our performance management system, all those, core functions that are essential to our operating, efficiently. So starting to look back at some of that and looking forward to getting back to some of those important tasks and functions. And then, so I'm just going to pass it over to Brian so he can give his update.
Thank you.
All righty. Hi, everybody. Brian Weeks here, epidemiologist at the Norwalk Health Department. I do need to request, because I'm joined by two devices, that the other Brian Weeks also is given the ability to share screen, because I'm going to pull up a PowerPoint. Seems like it's still not letting me present my screen. Yeah, it's still saying the host disabled participant screen sharing.
Megan, is that something you can help with? Is there a way to?
I'm reaching out to Megan right now, trying to ask her.
And in the interim, what I could do, here, I'll just verbally speak about it. Just won't have the slides just right up front. So the first slide that I did want to share is just kind of showing, the U.S. level of transmission for the last 7 days from the CDC. Right now, obviously, state of Connecticut, Massachusetts, and Vermont, we are qualified in the low category. So there's essentially 5 categories the CDC has developed. So there's high, substantial, moderate, low, and then no data. So we're in the low. So we're right next to having no data. So basically the lowest we could be, which is really great. The surrounding states from that point, based upon the CDC's analysis, it's in the moderate category. So you're talking about, level technically 3 out of 5, as opposed to 2 out of 5 where we're at, which is really 1 out of 4 if you really want to look at it that way. Really the states that are, the highest activity for the United States, you're looking at, substantial activity. So orange level, not in the red, not in high. And you're looking at Florida, you're looking at like Nevada, neighboring states like Utah, Colorado, places like that, in terms of kind of monitoring for, higher transmission. So what does that really mean? That's just kind of indicating, obviously, in terms of travel, people should just be mindful, especially traveling to states that are experiencing higher activity, which is really kind of outside, especially from the Northeast corridor, outside of Connecticut, Massachusetts, and Vermont. So I just really kind of want to emphasize that. But generally speaking, for the country in general, we're at moderate activity. Before I switch to my next slide, I just want to see if maybe I have the ability to share screen. It's still not doing it. So I'll just keep going forward without the slides. So my next slide here, data is for June 6th to the 19th. This is from the State Health Department. This is by county. What's really awesome about this is for leading and secondary indicators, we are all in the low, and really low in terms of just our case rates as well as the secondary indicators. So for the Fairfield County area, we're talking about 1.5 new COVID-19 cases per 100,000 of the population per day. And it's not the highest either. So we're tied with New Haven County, but the highest is Litchfield County at 1.8 relative to that indicator. So that's excellent news in terms of kind of our situation and what we've been kind of experiencing. Relative to each city and town, this is slide number 3. Just try seeing if I can share my screen again, but no. Pretty much everybody's in the gray. We only have 3 towns that are not in Fairfield County that are, in the yellow, which is just, level 2 of 4. And so that's 5 to 9 cases per 100,000. But we're, the city of Norwalk, as well as pretty much all of Fairfield County, is in less than 5 cases per 100,000 or less than 5 reported cases. So other excellent news. For the city
Brian,
itself.
you can share your screen now.
Okay. Thank you. I think you might have given it to the other Brian Weeks. So just as a heads up, everybody, I'm joining by my phone and my computer. My computer is where I'm sharing my slides. My phone is where I'm kind of speaking. Just changed. Thank you. So here, what I'll do is I'll jump right back to where I was before. It's a busy slide, but this is what I was referring to in terms of the CDC level of transmission. And so, yes, the whole country is qualified as moderate in terms of activity. So that's yellow. And you can see how, again, what I was talking about, Vermont, Massachusetts, Connecticut, we're in the blue, we're in the low, but then you can kind of see how we're surrounded in a sea of moderate activity, let alone then you have some of these orange states in terms of substantial activity based upon the CDC classification, especially Florida, and Nevada is going to be more popular kind of touristy destinations, in terms of the higher transmission. So something to keep in mind. As everybody's kind of factoring in, COVID transmission currently in the country in itself. So if we look at it from the county indicators, what I was showing before, we're all in the low. So pretty straightforward from there. And then if you look at it from the city and town perspective, here are the 3 towns that I was referring to that are in the yellow, but everybody else is in the gray. So again, from an artistic standpoint, not an exciting map, but from a COVID standpoint, a great map to have. And again, this is all relative to the time period of June 6th to the 19th, which has just been released just a couple hours ago from the State Health Department. They just updated, doing their weekly updates for this data. So now looking at for the city of Norwalk itself, again, this is the most recent data. You're looking at about 11,576 cases for the entirety of the pandemic, with holding steady at 225 deaths. And then what you can see here for the most recent 2 calendar weeks, again, the time period June 6th to the 19th, you can see actually a very significant spike or proportion. Keep in mind, this is not numbers, this is proportions. So the percentage of these cases that are showing up. Obviously, the number of cases we're seeing for this 2-week calendar period is very low. It's in the 20s compared to the previous time period, which was in the 30s. So we're seeing this just very gradual step of decreasing number of cases. But nonetheless, the 20-29-year-old age group is at 24%, noticeably higher than the rest. But you have a consistent 12% for the 10 to 19, 30 to 39, 40 to 49, 60 to 69, and 70 to 79-year-old age group. So pretty wide span in terms of the age groupings for the city of Norwalk. So something to keep in mind in terms of just, who's being impacted, a large proportion, but 20 to 29. And that's always an age group that we're very focused on because technically they're eligible for the vaccine. But the other catch is they're very mobile. It might be young professionals, it might be college students, they might be traveling in groups. So there's a lot of opportunities for a lot of interaction that's obviously going to result in potential exposure as well as transmission in the community. So still a very important thing to emphasize in terms of messaging. Now, in terms of vaccination, for the data that's up to June 23rd for the city of Norwalk, for individuals that have received at least one dose of the COVID-19 vaccine, we're at essentially 65%, 64.93. And that's for all ages based upon the way the state has published this data. So keep in mind that's also including ineligible age groups. Now, if you look at it for ages 12 years and plus, the ages that are actually eligible for the vaccine, technically these numbers are even better, right? So you're looking at, for those that have received at least one dose of the vaccine, almost at 77%. So that's really phenomenal for the age groups that are eligible for the vaccine for the city of Norwalk. In terms of fully vaccinated, obviously that number is going to be a little bit lower because that means getting all 2 doses if somebody's receiving the 2-dose vaccine. So that's at 67%, but still very good, especially in comparison to the state as well as just the other cities and towns in the state in itself. And as you can see, just with the darker color indicating higher percentage of vaccination, Fairfield County is doing much better than, especially when you look at the northeastern portion of the state in itself. And so obviously the big thing that we've all been hearing about in the news, it's been a major focus, is the variants. And obviously the other big thing about it is it's the big game changer that could really affect the future of the pandemic. Is the Delta variant too, has been a big focus. So as you can see here with the state health department and their surveillance for the variants, the large majority still is the Alpha variant, B.1.1.7, which is the UK variant at 42%. The Delta variant, being, the bigger focus is at 0.5% based upon the current state surveillance. But keep in mind, this is very targeted sequencing. It's additional costs, additional labor involved to take it to the next step to sequence these specimens. Just, because initially you get the determination if it is related, it's SARS-CoV-2 or not. And then next step is what variant of SARS-CoV-2 is it? And so probably the better thing to look at is, again, the CDC surveillance. This is 4 weeks up to June 5th. They just published this the other day. There's always going to be this time lag as they kind of compile this information. So this is for each state, and when it's showing data, it's indicating that there's been at least 300 specimens collected. But as you can see, for the state of Connecticut, we're at about 55% for the UK variant. Pretty much no data indicated for the South African variant, so it's kind of dropped off a little bit, which is pretty interesting based upon this targeted sentinel surveillance that they've been conducting. Obviously not a perfect picture, but it gives us a better idea of what's going on. California variant's holding steady at like 0.4%. Brazil, Japan variant actually a little bit higher at 7.6%. The big thing here is, again, Delta variant B.1.617.2 at 5.5%. And, compared to other states, this is actually pretty good. Because there's other states that are experiencing this in the double digits, if not the higher double digits. And, it's projected by the CDC that, next few weeks, if not next month or so, it's going to be the predominant variant in the country. And so that's because of its increased transmissibility. It's about 40 to 50% increased transmissibility compared to the Alpha variant, B.1.1.7, which in itself was already 50% increased transmissibility relative to the Garda variety COVID we were dealing with back in 2020. So that's an important thing to emphasize. There is increased transmissibility with the Delta variant. But, in terms of effectiveness of the vaccine, it's still pretty high. Based upon 2 doses, it's estimated somewhere around 88%. So the real message to come out of this, because the media might be presenting it as a bit of a scare tactic, but the real important thing is if somebody's fully vaccinated, then they shouldn't have too much concern about the Delta variant in itself. It's just getting them vaccinated to protect them against it, and then therefore also thwarting the opportunity for further transmission in the community. So again, not to be a broken record, but the thing I always like to kind of repeat is travel. This is, one of the greatest opportunities for an individual to be exposed to COVID and present with it inside the community when they return. And then therefore also expose others, and really help with the transmission of SARS-CoV-2. So just really want to emphasize that face masks are still recommended even for individuals fully vaccinated, but just keeping in mind the stratification. So not vaccinated, obviously implying that somebody's not fully vaccinated. So the big definition here is fully vaccinated. That's implying somebody's received the 2 doses of the vaccine if they're getting a 2-dose series vaccine, or at least the 1 dose if it's the 1-dose vaccine. And then they're given a 2-week window after receiving that final dose to develop that immunity, because the human body is obviously not something that rapidly develops immunity. It takes time for it to do it. And so it takes 2 weeks. And so once somebody meets that criteria, they're considered fully vaccinated. So That's just a point I want to emphasize there. So in addition to COVID, just some reminders, I've been kind of sharing it with other partners and meetings, is in regards to vector-borne disease. 'Tis the season, with this warmer and wetter weather that we're experiencing. There's a greater opportunity for tick exposure, right? People are going outdoors. In addition to that, there's, travel again, but, so tick-borne illnesses are obviously going to be increased risk, whether it's, family members that get exposed rubbing against brush or interacting somewhere when they're hiking, whatever it might be. But also keeping in mind, pets, because they're lower to the ground. Technically, they're more the main targets of ticks, and there's greater opportunities for them to get into the folds of the skin of animals, as well as behind the ears, things of that nature. Really just double checking your pets, after you return from being outdoors, even if it seems like it's more of an area that doesn't have a lot of vegetation, there is still opportunity for ticks to kind of present there, or they might have been introduced by somebody else's pets or some other kind of level of interaction. So I want to emphasize that point. And then obviously mosquitoes, right now they're kind of in a lower level stage in terms of not being as prevalent as they will be later on in the season. But it's still an important component in terms of human acquisition of the whatever virus or other pathogen they might be carrying. It's still even now in terms of taking those prevention measures. But the big thing to kind of reduce the opportunity for these mosquitoes to spread and really enter areas that are communities that actually have more people is really just mitigating, any sort of sources where water might collect. So whether that's going to be garbage pail lids, even areas on people's lawns where water might just sit, bird baths, making sure somebody changes out the water at least once a week, things of that nature, or if not, in other opportunities where water can collect, just dumping that water out. Because it only takes a little bit over a week for mosquitoes to really develop from eggs to larvae, then obviously to flying insects in themselves and being able to potentially transmit whatever disease that they might be carrying. So I just want to really emphasize that point. It's better to attack this early, just like as we learned with COVID. If we can enact those prevention measures early in the process, we have less headache to deal with later on. So an ounce of prevention is worth a pound of cure, so to speak. And so I just want to really emphasize that point. In the midst of everything else that is going on, obviously, we don't need anything else complicating our COVID situation. So if we can kind of just keep an eye on vector-borne disease and do our part in terms of spreading that message and mitigating opportunity for exposure and development of it, I just want to emphasize that. So that is my piece. Thank you, everybody. Really appreciate it.
All right, sorry about that. I was muted. Brian, thank you very much for the very thorough
Thank you.
updating.
That was very good. Thank you.
Any questions for either Deanna or Brian? Ms. Shanahan?
I have one question for Deanna. Now that they've started testing the waters, just wondering how clean the waters have been and whether there's been any need for beach closing with the rains we've had.
Hi, Lisa. Thank you for the question. The testing has been coming out good. We haven't had to close anything. We've had to do a few retests, but that's common. And then as far as the rainfall, we had that heavy rainstorm right when it was cold that one weekend. So that was the only time we had to close for rainfall. But that was a little earlier on.
Great, thanks.
All right, any other questions? Again, thank you very much, Deanna and Brian. Police update and discussion. Chief Walsh, you're up again.
Yes, for May 2021, we're at 175 sworn personnel. Currently, we have 6. At the end of May, we had 6 patrolman vacancies. 175 sick days were used. 160 workman compensation days were used. The Detective Bureau has seen a uptick in activity as across the board, and the whole police department has. They opened up 54 cases. They had 2 significant investigations. We had the homicide of Timothy Canty on Suncrest Road in May. We also had the murder-suicide on Chatham Road, which were both significant incidents. They took a lot of manpower. We are still pursuing many leads in the unsolved homicide and the rest of the other shooting incidents that have occurred since. The Detective Bureau has been very busy. So they remain open. So does the Norwalk Hospital case. We are pursuing that very diligently and tracking down every single lead. Special services in narcotics, they remain busy. 34 cases. With the reopening, we've seen a huge uptick in business on Washington Street. So we did do 3 liquor compliance checks on establishments on Washington Street to make sure that now as we reopen, everybody's going by the rules. In regards to, because we haven't been out there in a year doing any compliance checks with COVID. So, and plus some of the establishments have taken over new management. So we just wanted to introduce ourselves and just make sure everybody was permitted properly. We also assisted Stanford with a significant narcotics investigation, and they arrested 1 individual in possession of a large possession of narcotics after a drug investigation. Special Victims Unit in SVU, very busy, 55 cases. They did have 1 death investigation of a 12-year-old special needs student, significant. And they are dealing with a lot of school closures and graduations and assisting with the middle school graduations and also the high school graduations. Total criminal arrests for May 2021 is 149. Patrol Division calls for service, 4,000. We handled 4,744 calls for service in May. That is up probably 600 since last year. Just doing the stats from June 1st to June 24th as of this year, we're up 475 calls, especially on the first platoon, which is our midnight shift. Starts at 11 a.m., goes to 7 a.m. We did increase manpower back to pre-pandemic. We had cut back because the calls just weren't there. But we are bolstering staffing back on the first platoon to address some of those calls. We did that this week. Traffic unit activity, they made 399 car stops. They issued a total of 65 citations, 6 misdemeanor arrests, 129 written warnings, and 33 verbal warnings. For the month of May, they gave out, the department gave out a total of 237 infractions. And we still remain busy addressing several traffic hotspots as they come in. And we are deploying, we have several new signs, as you see around town, the speed signs that gauge your speed, but those signs also record all the data. So we could download those and we could get the times of day when the traffic is the worst. It actually counts the cars. So we're getting a lot of data. We're pulling a lot of data from those. So if a neighbor reports it, we have one on First Street right now. We have one, we just took one down from Overbrook Road. We have one on Newtown Avenue. And we do realize there is a speeding issue on East Rocks Road. It's those gentlemen that drag race, and we have been addressing them, and they have been arrested and then released, but that is an ongoing issue. So we'll keep on top of that.
Thank you, Chief. Any questions for Chief Walsh? Ms. Johnson?
Thank you. Chief Walsh, I just had one question that was a follow-up of sorts from the police commission meeting, because I've heard from some residents that they were unaware about this language line that the police department uses. And I was wondering if you could just mention to us, like, to walk us through what it is and then the steps utilizing the language line so that they could ask for it if they need it. And I assume it's just for Norwalk PD, is that right? Or is that for all?
Yeah.
Oh, seeing Diane, okay. Oh, we can't hear you. Oh,
Can't hear
no. Oh, I mean, I wish I could hear you. Okay.
You could type it into the chat if it works easier, and I'll read it out. Or
She'll come back. Okay. Well, then I guess my question defers until Councilwoman Revelous is back, because it looks like she's got some information on that to add. But maybe
Do you want me to answer or wait?
She's here. Okay. Maybe I'll defer to Councilwoman Revelous. Yeah.
You're muted, Ms. Revelous.
Can you hear me now?
Yes.
Yeah.
I'm so sorry, but I'm glad you said that. But the language line is something that I've been pushing. The language line is a service that our schools basically our municipalities have access to in Norwalk. All of them, our schools, the nurses' offices, the hospitals, the police department, the fire department. It accesses all the languages that you need for interpretation, even in these Zoom meetings. And how the city started using Zoom, the language line, it's because I've gotten the connection for our representative. This is something that we have an account for in Norwalk, and all of our services of this manner has accessibility to the language line. But I thank you for that, again, for that question, because I'm really happy about it because it's something we have and we really should be using a lot of.
Just to explain,
Absolutely.
how it
Yeah.
works here in the police department, if someone dials 911, we are the call center for the ambulance and the police. Someone dials 911 or 854-3000 goes to communication, and we can't understand them. They're speaking in their own language. The officer or the civilian dispatcher dials the language line, and we start a 3-party conversation. So from the police commission on Monday, what we're going to do, what we're looking to do is we're going to add a phone at the front desk. So, and we're going to post a sign. So if this occurs, with some instructions, they walk in, they could dial 3051, which is the desk officer on the other side. And then we could start the 3-way process again. So they could look at each other and we could start a 3-way process. But we're going to have to get a phone installed and get the sign in some languages to say, hey, dial 3051. And it's going to be some growing pains with that, but we're going to get it done.
Sorry, I muted myself. Ms. Revoluz?
Thank you. With the language line, just like, I don't know if you guys recall, if you've been in like a Quest and they have a thing on the wall that's in like 5 or 6 or 7 different languages of what's going on. Can they give you a sign in the same manner for the dialing needed for people walking into your front office? It's literally like an 8.5 by 11, but it's about up to 7 to 9 different languages. I'm saying if you need translation, dial 3, your number.
3051.
But they asked, the language line can actually provide it to you.
Okay, I was unaware of that. We'll talk to them, or if they can't, we'll have something made up ourselves.
Okay.
And get it professionally printed and mounted on above the phone.
And I just want to say I'm glad that it's being used and utilized. That's
It
all.
is.
Thank you.
Great. Chief McCabe, do you have your hand up?
Yes, just wanted to add to what we were just talking about with the language line. We're in the process of putting call boxes on the outside of the firehouses, where if the fire company is out on a run and someone comes to the firehouse needing assistance, they'll be able to use this box to call down to PD dispatch and report their emergency or give their concern. So I think that's something that we could probably add that signage to, and we could add the language line into that as well. And I'll follow up on that.
Great. Thank you, Chief. Any other questions? From the committee?
I don't want to ask a question. If I could just thank Councilwoman Revoluz for all this work on the language line, because it really came to a big point of conversation in the police commission meeting. So thank you, Councilwoman.
Agreed. Thank you, Ms. Revoluz. And thank you, chiefs, for both addressing it on the station and the firehouses and getting on top of that quickly.
I appreciate you all as well. All of you. Thank you.
Are there any other final questions before we call the meeting? All right. That being said, Ms. Revoluz, sorry, Lisa, she beat you again. She's getting good. She's getting good.
I am. Motion to adjourn.
All right. Well, thank you very much, everyone, for attending and answering all the questions. Have a good
George,
night.
you did it. It's before 8 o'clock.
Hey, yeah, look at that.
Look at that.
3 minutes to go.
We're in a very thorough, quick meeting, okay?
All right.
Good night, everyone.
All right, good night,
Good
everyone.
night, everyone. Thanks all.
Thank you,
Thanks,
everyone,
yeah.
for